Hi, my name is William Cahoon, and today I'll be presenting the Capstone Project. Here is my government ID. And today I'll be presenting the strategic market expansion for KBI Biopharma, a data-driven feasibility study for biologic CDMO services. And this will be by me, William Cahoon, today, November 30th, as part of the Baylor Institute Quantic School of Business Executive MBA program capstone presentation. Myself, I'm a consultant presenting to KBI, and basically, I'm presenting the challenge that KBI needs a strategic growth framework. KBI Biopharma actually lacks a systematic, data driven framework to evaluate geographic and therapeutic expansion opportunities. This creates risks of misaligned investments and missed growth in a rapidly evolving global CDMO market. CDMO stands for Contract Development Manufacturing Organizations, and basically, the biologics CDMO market has been projected to reach 42 billion by 2033 and is growing at 9.2% compound annual growth rate. Based on different studies that are conducted in 2025. Without strategic expansion, KBI was losing competitive positioning, and we really need to figure out what they can do next. What we did is we started with a market analysis where we looked at kind of the market opportunities. And, I mentioned the $42 billion global market size, the 9.2% annual growth rate. All of these and more explanations can be found in the consultancy report that I submitted as part of the Capstone, presentation report. Um, but what's also interesting is that we found that 37% of advanced therapies have year-over-year growth in cell therapy and gene therapy segments. So some of the advanced modalities have a lot more significant growth rate at 37%. What we also found in the market analysis is that outsourcing demand accelerates as customers and sponsors, favor external CDMO partnerships over building in-house capacity. And building in-house is expensive, and it has high capital requirements. So how did we kind of approach that next, right after understanding kind of what the market is? So our consultancy approach on KBI's expansion opportunities kind of focus on four different areas. First was that market analysis where we integrate external industry data with internal KBI project trends to identify global demand patterns across different modalities and geographies. After that, we kind of use different evidence-based strategic frameworks such as the pestle analysis for assessing macro environmental factors and Porter's five forces to assess competitive dynamics. Diving deeper into the competitive assessment, we also evaluate kind of the global CDMO landscape using the total addressable market, the serviceable addressable market, and serviceable obtainable market to model and estimate realistic market capture potential for KBI in different modalities and geographies. And then lastly, we kind of undertook some feasibility planning. So we developed a phased expansion roadmap with detailed action plans that includes different tasks, costings, timelines, risk mitigation techniques, and strategies, which we'll get more into. So ultimately, after we conducted our Porter's five forces and pestle analysis, and which are available in that consultancy report, what we found is that actually APAC has kind of the strongest opportunity, the Asia Pacific region. What we found is that they actually have the highest growth compared to the U.S. Or the European markets, and even though the U.S. and European markets do have areas where KBI could expand, this was kind of the strongest opportunity for a number of reasons. First of all, regulatory wise, the government backed biomanufacturing initiatives in South Korea, Singapore, and Japan definitely align with what KBI is looking to produce. And then secondly, KBI is also owned by a Japanese parent company, so they have a strong biotech pipeline with growing demand for CDMO services in the area. The other thing about the area is that regional CDMO services focus on small molecules, which leaves a gap in some of those advanced therapeutics that we discussed, that 37% growth year over year, in areas like monoclonal antibodies, advanced modalities like cell therapy and gene therapy, which KBI excels in. And lastly, favorable regulatory environments with clear biologics approval pathways exist in Asia Pacific, which is great with KBI's SOPs and the ways that they work. Ultimately, we found that the Asia Pacific region offers unmet demand precisely where KBI has established strengths. So this is definitely kind of the strongest opportunity. What are those strengths that KBI has? Well, when we looked at the strategic alignment, we found that KBI has a competitive advantage in a couple different areas. The first was scientific rigor, right? They have specialized expertise in monoclonal antibodies and some of those specialized modalities that we discussed. The next one is actually the speed and flexibility. So KBI's mission is actually to advance to improve the advancement of science and to, have that done relatively quickly. And they've actually proved that they can do that quickly and flexibly with a lot of different clients, which kind of gets into the last point, which is kind of proven capabilities. KBI has uh, done these sort of projects, for giant companies in the U.S. like Pfizer, Merck, Johnson Johnson, AstraZeneca, and produced successfully hundreds of batches for life-saving therapeutic and drug therapeutics and drugs involving cancer, kidney disease, and a lot of other therapy areas. So, how do we expect to expand to APAC? So, we kind of have a three-phase expansion strategy. The first one has a geographic expansion with pilot entry into APAC markets by leveraging favorable conditions and unmet demand. Next, we would kind of have a capability focus where we would focus on the modalities like the cell therapy, gene therapy, monoclonal antibodies, where global demand has been accelerating 37% and where KBI excels. And then lastly, we would kind of form strategic partnerships to have alliances with regional partners to reduce some of the risks of expanding over in the Asia Pacific area, helps to navigate regulations like using the parent company, accelerating some of the market entry by reducing some of the capital expenditures and overhead costs that can be shared. How do we do this? So there's kind of a 36 to 48 month roadmap. Phase one is where, in the first year to 12 months, where we would kind of undergo that market intelligence, create some partnerships, go through regulatory assessment. We expect to have some memorandums of understanding signed, a couple, like 2 to 5, so that way we kind of understand and get agreements with people that there is business to conduct. That initial investment will probably be 300,000 to 500,000. The breakdowns for that are also included in the breakdowns for all of these are included in the consultancy plan that I provided and submitted as part of the Capstone project as well. Phase two of this would be the pilot launch. So that would be about 12 to 24 months where we would find shared lab space, hire local staff, and then provide initial service offerings. That investment would be about 2.4 to about 4.7 million. But we would also expect to start generating revenue ranging from 5 to 8 million in that area during this time as well. In phase three, this is kind of last phase of 28 to 48 months, 24 to 48 months, where we would potentially construct a facility if needed, and be that manufacturing hub and have full operations, and kind of exceed utilization at 60%. And at that point, we would kind of expect an investment of 28 to 60 million, but we would also be producing around 20 to 35 million in revenue at that point. This modular approach allows validation before any major investments while maintaining agility. So that way we can make sure that, as we go through each phase that we validate that it's effective before, providing, increasing, numbers of investments in the area. And then the other thing is that those initial investments, we should be able to kind of recoup that through some of the revenue streams that it should generate through phase two and phase three. These are some of those expected outcomes and metrics and targets we talked about in year two, to have 5 to 10 APAC clients, about 40% utility, and 5 to 8 pilot revenue, along with a couple of partnerships and MOU signed. By year four is really where we expect to break even and have about 60% utilization, 20 to 35 million annual revenue, and 2 to 5 strategic partnerships, along with regional brand presence. There are some risks, but we can kind of mitigate that with some local regional consultants, partnering with our parent company JSR Life Sciences. We could also hire talent by having academic partnerships for talent, and also improve KBI's offerings by having flexible single-use systems for modular facilities designed to cater to clients' needs. So, in conclusion, to wrap that up, the time to expand, whether or not KBI should expand, well, the time to expand is now. With a structured, data-driven approach, KBI can strategically capture high-growth APAC markets and achieve sustainable long-term growth. This would approach opportunity with operational reality, which would basically validate the market fit before major investments. And we made sure that kind of that strategic fit, financial viability, and operational feasibility are all in line with kind of KBI's ways of work. So our recommendations for the next phase is to approve phase one market readiness and to do a regulatory assessment in Q1 2026 to begin the expansion. That's the presentation for the capstone. And thank you very much, and hope you have a great day. And looking forward to your feedback. Thank you.